Hey, welcome. Today we're going to dive into something that can feel, well, super confusing. Medical diagnostic tests. You get a result back and you're left wondering, what does this actually mean? Well, we're going to pull back the curtain on all the numbers and the jargon so you can really get a handle on the data behind your own health. So let's just jump right in. Imagine this. You go to the doctor, they run a test, and pretty soon you've got a result. It's either positive or negative. Simple, right? But how much can you really trust that result? Just how certain is that certainty? That's the big question we're going to unpack today. Before a doctor even thinks about ordering a test, they're already playing a game of probabilities. It's not just a simple yes or no. Based on your symptoms, your history, all of it, they're figuring out where you land on a whole spectrum of certainty. And what's really cool is that this scale here pretty much visualizes a doctor's entire thought process. Think of this line as the chance you have a certain condition, all the way from 0%, no way, to 100%, absolutely for sure. And the key thing to see here is that testing really only makes sense somewhere in the middle. So way over on the left, you've got this test threshold. If the chance of you having a particular disease is super, super low, honestly, it's just not worth doing the test. The risk of a misleading result that causes a ton of unnecessary anxiety is actually higher than the chance of finding anything real. So the right call is no test. Then you've got the other end of the spectrum, the treatment threshold. This is when all the signs are pointing so strongly to one diagnosis. Let's say the doctor is 95% sure. Well, at that point, waiting for a test to confirm it could actually be a dangerous delay. The top priority becomes starting treatment right away. Okay, so let's say you do land in that sweet spot in the middle, that testing indicated zone, and your doctor runs the test. It doesn't matter how fancy or high-tech the test is, when the result meets reality, there are only 4 ways it can play out. And this simple little grid here, this is the key to understanding everything. It's the universal scorecard for any diagnostic test. Across the top, you have the actual truth. The person either has the disorder or they don't. And on the side, you have what the test says, positive or negative. So let's break down what's happening in these 4 boxes. First up, the best case scenario if you're actually sick. You have the disorder and the test nails it. It comes back positive. That's a true positive. The test did its job perfectly. But what if you're perfectly healthy and the test comes back positive anyway? That's a false positive. This is the dreaded false alarm. It's an incredibly stressful result that just leads to more tests, more worry, more money, and all for nothing. Now this is easily the most dangerous outcome. You actually have the disorder, but the test says you're fine. It comes back negative. That's a false negative. It gives you a totally false sense of security and can mean you don't get treatment when you desperately need it. And finally, the result we're all hoping for when we get tested. You don't have the disorder and the test correctly confirms it. A true negative. That's the all clear. That's the real, genuine sigh of relief. So here's the bottom line. A test's quality is all about getting as many of those true results as possible and as few of the false ones. So how do we measure that? Well, clinicians have a very specific toolkit to figure out just how good a test really is. First on the list is something called sensitivity. The best way to think about this is as the test's detection power. It answers a really specific question. Out of all the people who definitely have the disease, what percentage of them will this test correctly flag as positive? It's really just the true positive rate. And look, this visualizes it perfectly. Imagine all those plus signs are people who have the condition. A highly sensitive test is like casting a really wide net. It's designed to catch every single one of them. Its number one goal is to not miss anyone who's sick. And here's a little trick that people in medicine use to remember this. It's a mnemonic, SNOUT. What it means is that if a highly sensitive test gives you a negative result, you can be really, really confident that you can rule out the disorder. Why? Because that test almost never misses a true case. So what's the other side of the coin? It's specificity. And if sensitivity is all about detection, then specificity is all about confirmation. It answers this question. Of all the people who are totally healthy, what percentage will this test correctly identify as disease-free? And this visual shows you exactly what specificity does. The minus signs here are all the healthy people. A test with high specificity is fantastic at correctly identifying all of them, which helps avoid those really stressful false alarms. Its main job is to not point a finger at a healthy person. And you guessed it, there's a mnemonic for this one too.
Spin. If a highly specific test comes back positive, you can be very confident that you can rule in the disorder. And that's because a test like this is just very, very unlikely to give a positive result unless the disease is really there.
Okay, so sensitivity and specificity, they're great for describing the test itself. But as a patient, you're asking a totally different question, right? You're asking, what does my result mean for me? To get to that, we have to see how this works with real people. So check out this table. It shows data from 1,500 people who were tested for something. So if we dig into this data, we can finally answer that huge question. My test was positive, so what's the actual chance I have the disease? And for this group, that number is 80%. This is so important, it has a name, the positive predictive value, or PPV. Notice it's not 100%. Why? Because of those pesky false positives. And now, let's flip it around. What about the other big question? Okay, my test was negative. How sure can I be that I'm actually in the clear? Well, the data shows that the answer is 98%. This is called the negative predictive value, or NPV. And as you can see, with this test, a negative result is incredibly reassuring.
So how on earth do doctors put all of this information together to make a decision? They use smart tools, like this thing called a nomogram. The easiest way to think of it is like a calculator. On the left, the doctor plots their initial guess, their pre-test probability. Then, they draw a line right through the middle, which represents the power of the test. And where it lands on the right is the new, much more accurate post-test probability. It's a brilliant way to turn a hunch into a real data-driven conclusion.
All right, so let's wrap this up. What are the big takeaways here? First, sensitive tests are for screening. They're great for ruling things out. Second, specific tests are for confirming. They're what you use to rule things in. Third, and this is huge, your own personal risk before the test dramatically changes what the result means. And finally, remember this, no test is perfect. It's never about absolute truth. It's always about shifting probabilities. And that brings us to a final, really interesting question to think about. Knowing everything we just talked about, if some tests are better at ruling things out and others are better at ruling them in, is the test with the highest overall accuracy always the best one to use? Or does the right test really depend entirely on what question you're trying to answer in the first place? Something to think about. Thanks for diving into all this with me.